Well, my name's Kenny Civello. I'm a practicing cardiologist and electrophysiologist. I initially, in addition to my medical degree, have a master's of public health and information technology. So this topic has always been dear to my heart. And it's taken a long time for us to finally get to the point where we can use tools that can actually lead to uh, more productive healthcare.
Yeah, I think your background in both public health, technology, and clinical is really fascinating to me. Do you wear or use a wearable, if I may ask?
I do. I do. I'm kind of a tech geek, so I probably have worn all of them. Currently, right now, I have an Apple Watch. I carry a Cardia 2 lead and 6 lead ECG in my white lab pocket. Kind of look at it like a modern day stethoscope that you can pull it out in clinic, or even I've even used it in situations where I've encountered uh, patients or people having problems in the community. So it's always something nice to carry around. I've had Aura rings, I've had Whoop bands. So yeah, I like them all.
That's great. And for so much of our conversation with healthcare, there's been this impending desire for consumerism to reach or penetrate healthcare like we've seen in other parts of our lives. Can you talk about what's happening in your practice relative to consumer wearables and data and how it's impacting the delivery of care or the monitoring of care?
Yeah, it's made quite the impact, but it's taken quite some time. I mean, I can go back. We all know when the iPhone came around in 2007. That was probably the beginning. It allowed us to have a tool that could collect data from wearables. First wearable, it's hard to believe, but was probably the Fitbit. You probably go to the pedometer before that, but the first real digital wearable was probably the Fitbit. And that was the first time that at that point people would come in because their wearable identified a problem. Where now we're seeing people bring in their wearable data to help with a problem. So it really, wearables have accelerated since Apple Watch came out in 2015. That's probably been the one tool that's got on everyone's wrist. But now you look around and everyone's got either a fitness band, a watch, a ring. So the data avalanche is coming, and I think I welcome it.
Is this a notion of just the worried well using this data, or have we reached a different point of the efficacy and the trust of the data, more medical grade, so to speak?
Yeah, it's a good question. I mean, I think wearables are nice because they do give you like a consumer empowerment. Like you feel like um, maybe a sense of control over what you're measuring. So for some people, maybe they have some health anxieties, and maybe the wearable, they feel will let them self-diagnose something that may have been missed. So, some of it is the worried well, but as we moved into the sort of era of quantifying ourselves, how well did we sleep, how many steps did we take, how many calories did we burn, uh, it is becoming not just something for the worried well, but something for people who want to be proactive in taking care of their health.
And from your perspective, when you think about wellness data and proactive data versus clinical grade health data, what is that distinction?
Yeah, probably has to do with FDA clearance at this point. I mean, the analogy is maybe you buy a $50 digital scale for your bathroom at home, and it's going to be pretty accurate in what your weight is. But if you go to the old school physician office, and there's the scale where you can actually it's calibrated and verified that you weigh this much. I think those are the devices that have been FDA approved, and so there's not a tremendous difference between a wellness wearable and a wearable that can diagnose and help you treat, probably other than the fact that it's been validated and as physicians we trust it. It does kind of create a little bit of a paradox though, because these companies don't want to spend the money to go through this FDA clearance because it costs a lot of money and maybe they don't get the clearance that they want. But then as a physician, a lot of physicians will say, hey, I don't trust the data. Like, am I liable for acting on data that hasn't been FDA approved? So there's a little bit of a paradox of, what is going to come first. I think my hope is that as everyone's wearing these wellness devices, the companies can then slowly layer on FDA approval on top of their devices.
How do you see this changing your practice? So, in the case of folks that need monitoring devices, of course, we're familiar with Holters or
Yeah.
implantable loop recorders, or now a Galaxy Watch or an Apple Watch or other devices. Has that changed what you're able to do in terms of monitoring pre, post, and during someone's health conditions?
Yeah, it was not that long ago that I would commonly recommend someone to get a implantable loop recorder, maybe because they had atrial fibrillation or were having symptoms. It's a very small monitor implanted underneath the skin. But for most use cases, not all, but for most use cases, I can say, hey, just use your watch or use a cardia device. And so it really has moved the needle on me being less invasive. The other thing some of the devices have done is, there's kind of maybe two ways that wearables work. One is you can do an ECG and take a snapshot, but there are some devices that have what you call irregular heart rate notifications, which is an algorithm running in the background, which is constantly continuously looking at the data and then telling you as a patient or consumer something may be wrong. Maybe you want to validate it and come to the doctor's office. So yeah, but it's absolutely changed my practice.
We know there's a deluge of data flowing. And if we even go back to 2010, there were some powerful clinical trials, and we knew that implantable devices could generate clinical data that were non inferior to the traditional wand and other methodologies. If we fast forward to today, we've got an avalanche of data, but we've always had this issue in our industry of signal versus noise.
Yeah.
How do we know there's the right amount of signal, or we don't want to create perhaps the parallel is the alarm fatigue for the nurse,
Yeah.
right, on the critical care unit? What do you do about that data as it flows and the integrity of the data, the quality of the signal? Has the industry moved forward on that issue?
Yeah, I think there's a couple of points you really brought up. The first is like getting through the noise of is it a good signal, right? And so as the wearables get better, technology gets cheaper, you're able to get better signal quality. We've all heard about there being a problem with darker skin tones maybe not picking up as much as lighter skin tones are. So I think that problem will get solved over time. But I would be lying if I didn't say that in my clinic day, I spend a lot of it looking at cardio recordings or Apple Watch recordings that say indeterminate or it can't tell. And so that creates a lot of health anxiety that, hey, what's going on here? My device is not telling me what's wrong with me. So I feel like there's a lot that we can do for that. But I think the main thing that we've seen in the past 2-3 years is the ability now to take the data and filter it through machine learning and AI. I think that's finally going to be the thing that will allow us to take the constant stream, or I call it an avalanche of information, and run it through filters that then will allow me to give you an actionable plan that you can do something with.
Yeah. And when that happens with data that comes back, and I'm using a non-technical term, you can't read it. What does that do for the patient relationship or the visit? Does it change? Is it like, well, this was extra data and it was nice, but because we couldn't read it, it's still okay? Or are you really looking forward to that level of intelligence that will help you better treat the patient over time?
Yeah, I'm probably an exception because, like I said, I was a little bit of a geek, so I embraced the technology. But I can see as a clinician it causing a lot of just frustration that you're spending your time looking at bad data, and so much so that albeit the Apple Watch is good, it's not 100%, and it's probably settling out in the 90% for sensitivity and specificity. And so when you actually have to correct what the watch is saying and say, no, that's not AFib, that's just premature atrial contractions, there is a little bit of trust that's lost. And so I'm just hoping with time we can overcome those obstacles.
And how would you describe your patients who are using these? Of course, there's so many views on older adults and are they savvy or are they not? And of course, it doesn't mean that someone who's an older adult is the only one that could have some of these conditions. But as people age, this becomes more common. In the last 10 years, you talked about 2015 with the Apple Watch. What have you noticed in terms of the folks who are using it and how they're embracing it? And is it a sliver or is that sliver growing to more and more
Oh,
patients?
it's way bigger than I would have ever thought. I mean, I have a couple of 90-plus-year-olds who have wearables. And so yeah, it's my mom is less than 80, but I probably shouldn't have said that out loud. But she's had an Apple Watch as long as I can remember. And so I think her generation is probably the first generation that has embraced wearable technology. And so she's going to be 80 soon, and she's comfortable with it. So I think as we age, I think it's going to be commonplace.
My experience in working with a lot of these great companies is this is not necessarily a technology problem. There are elements of this where you're describing the AI and the algorithms and the signal quality noise certainly is coming up to speed. How much of this is a medical practice delivery model equation in terms of care coming from outside into your practice? Things like remote patient monitoring, workflow, care teams, data integration. If you were to have to describe this challenge between technology, let's say Samsung Galaxy and Apple and Aura and Whoop did their job, so to speak.
Yeah.
If they were perfect, where would that put us in the healthcare delivery? And I would even throw in the financing arm of this, how we
Yeah.
get paid as clinicians.
It's going to create a seismic shift in healthcare, and we're not prepared for it. Dan, I'm used to practicing episodic care. You come into my clinic and you show me your blood pressure readings, and I tell you to go up on your blood pressure medicine. Where now the information is streaming in continuously. I'm not getting a snapshot of your health. I'm getting a continuous stream. So we need to develop protocols that take this data. We scrub it, for artifact and noise. We have protocols set in that then tell us, maybe what we should do next. I think in healthcare, a lot of people are concerned about artificial intelligence. A lot of people are concerned about artificial intelligence everywhere, but I like to use the word collaborative intelligence because I am then hopefully going to take those recommendations, use my wisdom of being a doctor for over 20 years to then make an informed decision about what to do with your health. But we need to change the way we practice medicine. Now, you mentioned financial. there are codes. 99453 through 99458 are the RPM codes. Now, those are for FDA approved devices. So these are codes that give the doctor and the doctor's office some reimbursement for their time. Uh, is it enough? Is it fair? It's probably close. And so we just need to have better technology to decrease the manpower hours that we use to look at the technology to make it where it's a fair use of our time and we're reimbursed appropriately.
Yeah, it's a great point. Are we training physicians properly to understand how to interpret this data? And please forgive me. I know physicians are incredibly well trained as
Yeah.
scientists, right? And these might be basal kind of readings, and it's not a big deal. But is it? I don't want to assume that it is or it isn't.
Yeah. One of my favorite vital signs is something called heart rate variability, which is really just, I kind of say, it sort of tells you how stressed you are. And it's a measurement that as a cardiologist, I was probably familiar with because we would see it on Holter monitors. But people wear Holter monitors for 24 hours, 14 days, where it wasn't until wearables came about that, companies like Whoop and Apple started honing in on, hey, this is something that we need to trend and something that's important to your health. I did not learn that in med school. I really didn't learn it until wearables. And I would still probably say if you asked 10 doctors what heart rate variability was, I don't think it would be the majority knows what the answer is. So, yeah, there needs to be training in this type of data and how to use it.
You've talked about an avalanche. There's this irony for me that we have more and more consumer data that is not consumable,
Yeah.
perhaps for the practitioners and the clinicians. Are we at a tipping point? Is this, and we've talked about tipping points in healthcare for 20 years,
Yeah. Right.
right? With all
You're
of this,
correct. Yeah.
is this time really different? Is this evolutionary, or are we going somewhere further?
It's different. And I'll tell you why. It's different because before, physicians or healthcare would dictate to you how fast things were going.
Hmm.
And we're slow. We're slow because of healthcare security. We're slow because of reimbursement. We're slow because we're set in our ways. But now you as the consumer are taking the information and you're giving it to me. And I can do one or two things. I can say, I'm not interested in your data. And guess what? You're going to go find a new doctor. Or I can say, okay, well, I need to work with you to look at your data and I need to know how I can, get paid so my practice can be sustainable.
Yeah.
I spent a lot of time looking at cardiac ECG readings at the end of the day, and I mean, could I go home an hour earlier? Yeah, sure. But it's important for people who are sending me their information all the time that I review that data and get back to them to let them know everything's okay. So I think it's going to change because the direct to consumer model is going to change it.
So we've heard about pajama time with EMRs, and you just brought up something that scares me, right? You and a lot of other physicians and clinicians are staying maybe that extra hour because now we've got consumer data flowing in. If I'm a doc listening to this and I'm skeptical, you just might have confirmed my skepticism. What advice would you
Yeah.
give these clinicians who are skeptical? Are we just adding to pajama time because people are now wearing rings that look like rings but make me wear pajamas longer?
Yes, I hope we are in the day of early EMRs where doctors were throwing computers across the room because they were so frustrated with the EMR and how it worked. But, you ask any patient and a doctor who's tech savvy, does something like my chart help them? It does. It helps me. I use it all the time. I mean, if I picked up the phone and called you, we would probably have a 5-minute conversation But if you ask me a question in a almost like a text message like question, I'm going to send you back a text message like question. That's going to take me 30 seconds and I'm moving on with my day. So, we're going to need some technology to help us process that information, but I believe it will come.
Mm-hmm. Final question. This has been fascinating. What's one thing you want listeners to take from today, both a consumer, a practice administrator, a clinician, our device partners, et cetera? There's a number of different constituents there. And as I like to say, if we make it good for one, but bad for the others, we have a problem. And so they're
Yeah.
all listening, hopefully. What's one thing you
Yeah.
want them to take away?
Well, I think since there's two parties, I guess I would have to say one thing to the physician and one to the patient. For the physician, I would say you need to meet the patients where they are. And they are at a point where they are looking at their wearable information and they may need help interpreting it. So if you want to move and advance your practice and how you treat patients, I think you need to meet patients where they are, and that's they're wearing a wearable. I think for patients, they need to realize that these are not toys anymore, and they're tools, and they're tools that may allow them to diagnose atrial fibrillation earlier, to real soon to know whether or not they have hypertension. We didn't even talk about continuous glucose monitors, which I can talk hours on. But yeah, they're not they're not toys, they're tools, and you need to learn how to use them and empower yourself to take better care of your own health.
Yeah. Well, Dr. Civello, that was wonderful. And I think you ended in a way that will stick in my head. Tools, not toys,
Yeah.
right? I think,
Yeah.
and that's that tipping point. Thank you so much for this great insight.
No, thanks for having me.